Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. Cardiac care dominates this week's news, with most of it coming from the annual meeting of the American Heart Association in Orlando, Florida. The top story is the release of the SPRINT study, which found that giving older adults more therapy to lower their systolic blood pressure 20 points below the usual standard dramatically reduced heart attacks, strokes, and cardiac deaths. The results were so substantial, the National Institutes of Health ended the study early back in August. While the AHA called for more attention to high blood pressure, it may take some time for clinical guidelines to catch up with the new study. More data are also needed to address the cardiac needs of patients who have been treated for cancer. That's what Dr. Crystal Denlinger of Fox Chase Cancer Center told AJMC at a separate meeting recently.
Right now, at the state of the data, we don't have a lot of large randomized trials that demonstrate definitive evidence that routine surveillance or early institution of heart failure therapies changes outcomes, and I think more research is really needed to really be able to show that this is important. But what we do know from the heart failure literature in non-cancer patients is that treating asymptomatic patients with structural heart disease or patients who are at risk for heart failure with ACE inhibitors can improve heart failure associated outcomes like the development or hospitalization for CHF, or the development of CHF or hospitalization for CHF, or death, and I think that, or death from CHF, and I think that those outcomes and those therapies could be translated into the survivor population. But I think more data is needed before we can definitively say that that's the case.
The AHA meeting also brought a joint announcement with Google Life Sciences, with the two groups pledging a total of $50 million to study the drivers of heart disease. The collaboration is Google's latest venture into healthcare and will cover clinical research, engineering, and data analysis. The current issue of evidence-based diabetes management features a commentary from Dr. Francois Nicolas of Sanofi about a similar partnership with Google Life Sciences, which was announced earlier this year to study diabetes. To read the commentary, visit ajmc.com. Connecticut, Florida, New Hampshire, Pennsylvania, and Virginia. What do these states have in common? They're the states where enrollment in the healthcare marketplace will have outpaced projections the most by the end of 2016, based on estimates by the Urban Institute. According to the group, these 5 states have had successful enrollment periods in the past, and that will likely bring more of the same in the current sign-up period. The third year of open enrollment is a low-key process compared to 2013, when widespread problems with the website healthcare.gov gained attention. With new goals for value-based reimbursement coming in 2016, there's more attention than ever on coordinated care. AJMC spoke with former Congresswoman Allison Schwartz, now president of the Better Medicare Alliance, about the importance of Medicare Advantage.
What's exciting about being at this conference and really talking more about insurance design and value-based insurance design is that we talk a lot about value-based healthcare, and that, of course, the option of insurance companies being able to offer Medicare Advantage and to combine Part A and B, hospital and physician services, and often Part D, and a variety of enhanced benefits, and to do it in a different way that really speaks to what makes a difference in seniors' health care. And so we're talking about the focus on primary care, care management, coordination of care, more integrated care, and of course a focus on chronic disease and working to reduce the progression of disease.
If you want to learn more about the need for value-based care, join us this week in Baltimore at Patient-Centered Oncology Care, our 4th annual summit to bring together stakeholders in cancer care. To learn more, visit our conference page at ajmc.com. For all of us at the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.